did your health history and your assessment, I'd like to discuss some of my concerns with you.
Okay.
You mentioned earlier that you floss regularly. Can you tell me what you mean by this?
Yeah, I floss it when I watch TV, and that's probably about like 3 times a week.
Okay, great. I asked because I noticed there are many areas in your mouth where your gums tend to bleed easily. I also have some concerns involving some 4mm deep pockets I found in your assessment. These pockets show me where your gums attach to your teeth. So the smaller the pocket, the better. Okay. There's also one more thing I'd like to show you. See the gum between your teeth right here that comes to a point?
Yeah.
This is called the papilla. So when you're flossing, you want to make sure you don't damage the papilla. So it's very important that when you go down gently. Because if you snap through, it'll hit the papilla and cause some harm, and it'll irritate your gums. If you stabilize your fingers on other teeth or on the surface of your teeth anywhere, it'll put less pressure on the floss, and you won't go down as hard.
Alright.
Can you please demonstrate to me how you normally floss?
Sure.
Okay, thank you for demonstrating. I really like how you hold the floss with your index fingers close and it wrapped around the middle finger. A suggestion I can make to you is pulling the floss up and down between the teeth. You make a C shape around the tooth and then pull it up and down in a shoe shine motion.
Okay.
How does that feel?
It's not working.
I know it's not the easiest thing to do. There are many alternatives I can show you instead of flossing that may be easier. One example is a floss stick. So what it is basically is a piece of floss on the end of a stick similar to a toothbrush.
Definitely like these options. Which ones would you recommend so that my gums don't bleed?
Well, both are equally as effective at cleaning in between your teeth as long as you're doing it the right way and as long as you do it frequently, so at least once a day.
I think I'll try the floss holder.
I'm really glad to hear that. I think it's a great idea and it's actually quite simple to use.
So when I get the floss holder, I would like to come back to just make sure I'm doing it right.
Yeah, for sure, that sounds perfect. I'd love to show you again. Do you have any more questions about flossing before we move on?
No.
Can you tell me anything you know about plaque and the benefits of brushing your teeth?
Plaque is like the bacteria and like food that gets stuck on your teeth, and I know that like brushing and stuff like helps remove that, but like in the morning I can still feel all that like on my teeth and it feels really gross.
Okay, yeah, that's a really great starting knowledge. You're right that brushing your teeth does help remove the plaque from the surfaces against your cheeks and tongue. So just because someone has a lot of plaque on their teeth doesn't mean that they necessarily have a cavity. However, the plaque will cause them to be at a higher risk of developing a cavity. And it's not only about the teeth, the plaque can also damage the other tissues like your gums as well.
I always brush my teeth in the morning, but sometimes at night like I get like super tired and I like don't brush them, I just leave it.
Yeah, I can completely understand about being super tired at the end of the day, but it is really important to always brush your teeth before bed because you don't want all the plaque that accumulates on your teeth during the day to stay there overnight. Maybe try brushing your teeth earlier in the evening, like an hour after you have dinner, before you get super tired, just in case you do end up falling asleep. Right, so now, would you mind demonstrating to me how you brush your teeth?
Yeah.
like to give you that could improve this technique a little bit. Is that all right?
Yeah.
I'd like you to make a 45-degree angle pointing towards the gums. Like this. Can you try that for me?
Yeah.
Try going in from this direction. If you hold the toothbrush like this. So a bit more angled. Yes, just like that. All right, now I'll show you the next step. So you'll have the bristles pointing up towards the gum in a 45-degree angle, and then you're going to shimmy the bristles like this, back and forth. And this way, the bristles will go up into the pockets and remove all the plaque and bacteria. Can you try that again for me?
Yeah.
That looks great. All right, so the next step is when you do that shimmy, you'll sweep down, and then you replace it and sweep again.
Okay.
That looks great. Okay. So you'll carry on with this motion across your entire mouth, everywhere. In the top teeth, the bristles will be pointing upwards towards the gums, and when you're doing the bottom teeth, they'll be pointing downwards towards the gum. Because really what we want is to get the bristles deep and to sweep out all the plaque.
Okay.
All right, so you're getting the sweeping part really well. You really want to make sure the bristles are angled at a 45-degree angle instead of straight on. Do you know what type of toothbrush you're using right now at home?
It's a mechanical, and it's like, I don't know, the bristles are kind of like stiff. I'm like, I don't know.
All right. Well, I can give you a toothbrush today, and it's a soft bristled toothbrush. So that's what you'll want. You want to make sure that it's a soft toothbrush. That'll be much better for your gums. Because you're just starting this new technique and you're going to be flossing more regularly, it will be normal for your gums to bleed at first. So if they start to bleed, I don't want you to think that that's a reason to stop. Brushing and the flossing will actually improve the bleeding over time.
Okay.
Also, you mentioned earlier that when I was probing, you felt some discomfort.
Yes.
This brushing technique and flossing more regularly will help your gums, and you'll feel less discomfort when I probe the next time.
Okay.
All right, so how does all of this sound so far?
Pretty good.
Good. I know I've given you a lot of information. Do you mind telling me what you've learned so far?
So when flossing, I want to make sure to hug the tooth and make a C shape.
Perfect. It sounds like you really understood everything I've told you so far. So before we move on with the rest of the appointment, do you have any questions for me about brushing or flossing?
So, like, where can I get like a soft toothbrush?
Grocery store, at Shoppers Drug Mart, Walmart, anywhere would really be good. You just want to make sure that it's a soft toothbrush and not a hard one.
Okay, so that's like on the package?
Yeah, it'll say right on the package if it's soft bristles. That's what you want, or even extra soft.